Fever 101. Understanding, treating, and preventing. Learn more about the causes and symptoms of fever, along with treatment options and tips for prevention. What is fever? Fever is a temporary increase in the body's temperature, usually caused by an illness or infection. The normal body temperature ranges from 97 degrees Fahrenheit to 99 degrees Fahrenheit, but when it goes beyond that, it can be considered a fever. Low-grade fever. Mild fever ranges from 100.4 degrees Fahrenheit to 102.2 degrees Fahrenheit, 38 degrees Celsius to 39 degrees Celsius, and can be managed at home. High-grade fever. Fever above 102.2 degrees Fahrenheit, 39 degrees Celsius, may require medical attention depending on other symptoms. Prolonged fever. Fever lasting longer than 5 days could be a sign of a serious condition and should be evaluated by a medical professional. How is fever measured? Digital thermometer. The most common tool to measure body temperature. Ear thermometer. A non-invasive option for children and adults. Forehead thermometer. A contactless way to measure temperature using infrared technology. Causes of fever. A fever is usually a symptom of an underlying condition, such as 1. Infection. Most common cause of fever, from a cold to a more severe illness like pneumonia. 2. Inflammation. Can result from autoimmune diseases or injury in the body. 3. Cancer. In some cases, cancer can cause a fever. Symptoms of fever. Along with an elevated body temperature, there are other symptoms associated with fever such as chills, feeling cold even in a warm environment, sweats, excessive sweating, especially at night, headache, pain in the head or behind the eyes. Treatment options. Most fevers can be managed at home with the following. 1. Rest. Resting helps the body fight the infection or illness causing the fever. 2. Hydration. Drinking plenty of water, juice, or broth can help replace fluids lost due to sweating. 3. Medication. Over-the-counter medications such as acetaminophen or ibuprofen can help reduce fever and relieve other symptoms. When to seek medical attention. Call a healthcare provider if high fever with a temperature above 103 degrees Fahrenheit, 39.4 degrees Celsius, that persists for several days or is accompanied by other symptoms such as chest pain or difficulty breathing. Signs of dehydration, such as dry mouth and eyes, dark urine, or decreased urination. Seizures, confusion, or severe headache. Prevention of fever. There are several ways to prevent fever, such as clean environment. Clean and disinfect frequently touched surfaces to prevent the spread of germs and infections. Hand hygiene. Wash hands regularly and thoroughly to prevent the spread of germs. Vaccination. Get vaccinated against illnesses that can cause fever, such as the flu or meningitis.